So I was a vegetarian most of my adult life. However, I was a Milky Way or junk food vegetarian. I thought I was happy and healthy, but I struggled with weight and I struggled with inflammation, and my cholesterol was high, much higher than it should be. When I discovered a whole food plant-based diet, my whole life changed.
Hello to everyone in the world. And I just want to say hello to everyone that is joining the show today from all over the world. It's really amazing how many people we get from all over the world. I am Dr. Sal. I am the medical director for Lifestyle Medicine Institute in the CHIP program. I want to really welcome everyone today to the program. We have another tremendously exciting program today, which we do every single week. And I say that with all honesty. We have the best speakers on, the best people coming on to tell us their experiences about lifestyle medicine and the CHIP program, and hopefully the attendees are learning a lot. So let me get to the introduction so we could talk more about Kim's transition, if you will. Dr. Kim Scheuer started her career actually, interestingly, as a teacher for deaf children. And then she went on to become a physician, board certified in family practice and lifestyle medicine. She practiced traditional, similar to what I did. She practiced traditional medicine for about 20 years and then really started to focus on lifestyle medicine. I think we all have this transition. And what she realized, like so many of us have, is that you have to focus on the root cause of a problem, which is really something that in the traditional world of medicine, we really don't do very well. Through all of the work that she did, she found the CHIP program, the Complete Health Improvement Program, which she actually facilitates. And Kim will tell you this, she adopted her own plant-based nutrition program and lifestyle after realizing, and she'll talk about her story, that she was eating a vegetarian diet that was filled with a lot of junk food. And it's interesting the way she put it in here, that she thought that she was eating healthy, which is what I hear from so many of my patients. And she'll tell us about her transition and her journey really into a healthy lifestyle. She's brought about her own personal changes into her practice. I'm going to just tell you quickly, I'm not going to tell you too much about her story, but she has her medical degree from the University of Rochester School of Medicine. She is educated as a specialist for the deaf, and she did her residency in family practice. She's board certified in family practice and in lifestyle medicine, and she is a CHIP facilitator. So without further ado, I will ask Kim to join us and tell us about her life. Hi, Kim. How are you?
Hey, nice to see you. How are you?
Nice to see you. How you doing?
I'm doing well.
Little chilly over there in Colorado?
A little colder than probably where you are. Yes.
I'm in Florida and it's a little warmer. Yes.
Yeah, no.
So tell us, I didn't read the piece that you sent me about your transition when one of your friends asked you to do a 3-day food diary.
Yep. So in about 2011, I was 47. My mom had breast cancer at 48. And I thought, how do I prevent breast cancer in myself? At the same time, a very good friend of mine was taking a nutrition course. So she asked me to do a 3-day food diary. I filled it out, gave it to her, waited about a week and thought, I'm going to do great because I eat better than 90% of most Americans. And she came back in not the nicest words. She said, you eat like crap. And it was actually not that nice.
Right.
And so she told me I eat terribly. I had to get rid of, I was a vegetarian, but I called myself a Milky Way vegetarian. I ate probably cheese 4 or 5 times a day because I was a cheeseaholic. I ate junk food, packaged food. What was easy, I did. And I just grabbed and went and I ate tons of crap, lots of cookies and, Oreos are vegetarian and they're even vegan, but they're not healthy. So She told me I had to eat healthy. I said, I don't have time to cook for this. I'm a busy physician with a practice and working in the hospital and this and that. She said she'd cook for me and she made me a green drink because I had never eaten salad. I did not like lettuce and vegetables and fruits and things like that. I didn't eat any of that. So she made me a green drink and I was like, I'm not going to drink that, but She said, try it. And I tasted it. It was delicious.
Right.
And so for a month, she cooked for me.
Wow.
And in that month, my weight plummeted, my cholesterol plummeted, my energy skyrocketed. I would, instead of waking up exhausted at 5 o'clock in the morning to start my, 12, 14 hour day, I would wake up like, let's go play.
Mm-hmm.
And it changed my life so much. And I got rid of all the junk. I started after a month to crave salads. It was like, who is this person? I couldn't believe it. So I started doing research. I ended up reading the China study and looking at forks over knives and reading some of Dr. Furman's books. I got into nutritionfacts.org with Dr. Greger, who was fantastic. I started doing the research and learning things that was like, why didn't I learn this in medical school? I was so mad because I had been overweight all my life and struggled. I had thought I was healthy, but I obviously wasn't. And it was so easy. And I am a foodaholic. I love food. And so my palate changed and I could eat as much as I wanted. I eat so much more than I used to. For the first time in my life, I had to eat more to not lose too much weight. Yeah. I had never experienced that in my life. And it was great. I was like, wait, I need more nuts and seeds. I need more, I need more calories because I'm eating so much, but I'm losing weight. And it's
certainly, in the CHIP program, the section on protein comes up, and so many individuals will say, well, if I'm eating a plant-based diet, how am I going to get my protein? So you go answer that question. And really the only time in my practice that I've seen people lose weight on a plant-based diet is if they're not eating enough. Right. So your point is very, very important to for the people that are new to CHIP to really understand that you have to eat enough food, because you're eating this volume of food that's highly nutritious, low in calories, and you have to make sure that you're eating enough. So what did you say before? And my father used to say this, you eat like a pig? I do. I eat like a pig. Exactly. Well, my significant other calls me a hobbit because I eat my first breakfast, my second breakfast, my first lunch, my second lunch. Oh, that's great. Yeah, that's great. And really, I like what you put in your bio here and the information that you sent me about walking the talk. Yes. And I obviously, like we all do, we talk to other healthcare professionals, and the important message to deliver is that we all need to be role models for healthy living. You don't have to look like Jack LaLanne or whomever, but you really have to at least convey to the people that we try to educate, other healthcare professionals and patients, that you have to, walk the walk and talk the talk and be a role model, which obviously you are. Well, I try to be. I live in a very active area, so there's a lot of keto, paleo kind of people in my area. And I say, and they've tried, the Atkins diet, the this, the that. And first of all, it's not a diet, it's a lifestyle change. And second of all, look how Atkins died. He died overweight and unhealthy. And so if the people you are trying to emulate aren't healthy, don't try and emulate them. Yeah. Yeah. It was interesting, and certainly not to defame him in any way, and Mike Greger, Dr. Greger, talked about what his autopsy, what it said on his autopsy. I think we really have to address that, the difference between a complete health improvement program. Correct. Whether it's our program or a program that you develop for someone, is to really look at the science. Yeah. And look at your anecdotal stories, because we have hundreds, if not more, thousands of stories from our patients over the years, how people do when they eat, keto or South Beach or whatever, paleo, and when they really truly eat healthy food. You know? And I tell my patients, I can get you to lose weight. I can give you chemotherapy. I can give you, amphetamines. That's not healthy and it's not sustainable. What I want you to do is be healthy and lose weight. Yeah. If that's your goal. So how did you get involved with the CHIP program? I was at some lifestyle medicine conferences and found out about CHIP, and I was
actually, it was before I took my boards. I was at some plantation project conferences, and I was like, well, maybe this will be a good way for me to study for my boards, is to find out about this CHIP program. And I looked at it online, and then I looked at becoming a facilitator, and it was fantastic. It was a good way for me to review the CHIP material, to learn to study for my boards. And then at that time, I couldn't start being a facilitator for about a year because I was doing too much of my traditional life medicine, family practice, and I just didn't have the time. But when I had the time, I started running CHIP programs. And even though I knew it would work, because things like this had already worked for me, but then I'd always also used lifestyle medicine with my patients. But when I started the CHIP program, I was amazed at not only the program's fantastic, but the buy-in that people did. And so, because it's one thing to say, I want you to change your lifestyle, but if you don't buy into it, if you don't see a reason for it, it doesn't really work. And so the CHIP program just incorporates everything from diet to stress reduction to moving more and exercising, and sleeping better and avoiding toxins, things like that, that it really made a difference. And the group participation part of it too. Made a huge difference in my, in the participants. And I loved watching them change because they were me several years ago.
Yeah, it really is incredible how they feed off of one another. To really understand, like, if you have a particular barrier that has not allowed you to get to whatever your health goal was or is, somebody else may already have that solution to that. I just put a little reminder in here for the people, if anybody on the line has any questions for you, to put them in the chat box so we could answer some questions at the end. But yeah, it really is a transition, and I like the way you describe how you really go on that journey from where you are now to really where you want to be. Which sometimes is a long span, but you do it in little bits, and you really celebrate those small wins. How do you, though, as a physician, be a facilitator? Because that's a real stretch, and it's an amazing thing to be able to do. How did you manage that?
I had been trying in Aspen, Colorado, where I lived. I've been trying to make Aspen a blue zone. And I had tried to work, and if people don't know what a blue zone is, a blue zone is an area around the world that's circled in blue, where the longest living people and healthiest people live. And there's 5.
Don't tell them where they are.
Okay.
See if people can put them in the chat. See if they know where they are.
Okay.
Because this is really cool. So finish your definition.
So it's an area where around the world, where these groups of people have very some similar qualities. They are more plant-based. They move naturally. A lot of them are outside gardening, things like that. They have a good sense of community. They have a strong family ties. They have a couple, about 9 things that are about similar. And you can make a blue zone. They've done that where instead of these natural blue zones, they've made them in different places. And Aspen, Colorado was the place where I thought that would be perfect. So people are mentioning Loma Linda, Okinawa, Sardinia, Italy. I mean, perfect. These are some of them. Costa Rica.
That's the other one.
And so what does Okinawa and and Loma Linda, California have in common? And in California, they are the Seventh-day Adventists who believe their bodies are temples and they treat them well. They don't drink to excess. They move. They eat healthy. Those kind of things. And they have a very strong sense of community. So I wanted that in Aspen. I worked for years trying to get that to Aspen. Nobody was interested. Then I took the CHIP program, became a facilitator, and I went to the hospital. And I said, you need to have CHIP taught at the hospital. And you need to have it at the county. You need to have it at the RAFTA, which is our bus stations, and the schools and this. And nobody would take it on for the longest time. I mean, in the hospital, they're serving bacon for breakfast. I can't stand it, and they have vending machines with sodas and candy bars. And so despite all the scientific and medical evidence that this is bad, when you have somebody coming in for a heart attack,
right,
you give them steak and
eggs.
Yeah. Afterwards, that's ridiculous.
Right.
You're just giving them the same thing that caused their heart attack. And there's a lot of education. It's changing, but it's incredibly so. Sorry.
Yeah. It's interesting and I think it's a good reminder, whether you're a true healthcare deliverer, on the front lines, actually seeing patients, or you're an administrator in a hospital, we all have to abide by the Hippocratic Oath.
Yes. Which
really says to do no harm. And when you intentionally let people become unhealthy, you're doing harm to those people. And that's exactly the opposite of what we're supposed to be doing as healthcare providers.
Yep.
And, the people that run hospitals, they should be pulled on the carpet for that, because,
absolutely,
we're in the business of healthcare. We shouldn't be just in the business of sick care.
Right.
And, that's why I really like the name of the CHIP program, the Complete Health Improvement Program, because we should be delivering complete health to people.
Absolutely.
Yeah.
Absolutely. Yeah. And so finally, somebody at the Pitkin County in the health department finally said, yes, we're interested. And we got a small sum of money to help support it, and hooked up with Forks Over Knives, and they were wonderful in terms of giving the people in the CHIP program some magazines and some encouragement. And we did our first CHIP program. Of course, that started we did our first class the day before COVID hit.
Oh, wow.
So we did our first in-person class the day before COVID hit. COVID hit. Mm-hmm. We had to cut that. We had to cut it out. And for about 2 weeks, I worked to convince the county to do it online, which I've never done online. Mm-hmm. And we managed to get it working. And we had a couple of people backed out due to the stresses of having to work so hard with COVID and manage that. And then also some other things. And some people, Aspen is well known, but somewhat rural. So it's hard to get on internet for some people. Mm-hmm. But we had this great group of 6 who stuck it out, and they were phenomenal. And the changes they made together during a difficult time was incredible. So they were making positive changes. They were feeling better. They were getting healthier. When everybody else was putting on the COVID-15, they were losing the CHIP tip.
Right, exactly. That's true, right? The pandemic weight that so many people put on. Yeah, it's amazing. I mean, when I left Lee Health, by the time I left, and I was there for 26 years, but for the time that we were doing CHIP programs, we did 19 programs. Yep. And we showed through the health plan initially with just the first few that people got healthier. Yep. The cost of our health plan went down. So they actually made the program part of the health benefits for employees and dependents that wanted to be involved. And, you could look at people in the short term when you're doing the program itself, but if they stick with the program and they're involved in club CHIP programs and support groups and all, we looked at their data after a year, and people still were having the same clinical benefits. They were having the same financial benefits. Yep. So is your health system doing anything in that regard, looking at long-term utilization? We hope to, so far what we're doing, we have a weekly CHIP check-in. Mm-hmm. So all the groups can come in and it's not mandatory. It doesn't cost anything. We'll do it tonight. Just hang out for about a half an hour. And how are you guys doing? Has anybody fallen backwards? What we can do to help? And the support in the group. In fact, we just had a couple of people do the 5-day reboot again. Just, oh, good. Because they were, over the holidays, they had gotten tempted. And so they worked together, and they're fantastic. We've had one of the people become a CHIP facilitator, and she's hopefully going to start doing CHIP with more Hispanic community out there. And we've had another one who spent, she had a 20-year goal of hiking a 14er. Wow. And we hiked a 14er with her, and it was great. So that's amazing. The way that you describe changing people's lives that in and of itself is so rewarding for any healthcare provider, to just be able to change someone's life so that they can actually climb a mountain, which is incredible. You do have a couple of questions here.
Sure.
Amber says, I'm a CHIP facilitator that will be facilitating a virtual CHIP program for hospital employees during the lunch hour. How can I make the CHIP program engaging and effective virtually on such a time crunch in that hour?
Our groups have been very communicative, but one of the things that we did, especially because it's a lunch hour, is maybe suggest, as you're getting into CHIP, a recipe exchange, so bring your favorite recipe, eat it, show it to them, and then share it with everybody. So that's one way to make people engaged. What did you find this week from your book that was good, or did you find something else from a different place, or what have you tried? Great. So that's one of the things that I would suggest. Another thing is, maybe while you're doing the CHIP virtually, take 10 minutes to have them start walking in place, or, while you're talking, and do that together while you're telling your stories of the week. So you're actually moving and engaging.
I like what you said about the recipe exchange. There was a program on, I'm not sure if it's still on, it was called Rehab Your Recipe. So it was two vegan chefs, and they would just go into somebody's house, into their kitchen, and they would ask them, what's your favorite recipe? So it's mac and cheese or whatever. And they would rehab their recipe into mac and cheese in a healthy way. And, that was incredible. So maybe as part of the answer here to the people, if you can share in that hour what you've done to rehab your own recipes to make it healthier, just sharing that, because, that's the action plan. When you go through CHIP, you get a lot of didactic knowledge. Now, how do you actually take that and to put it into action? So that's really key.
We did a lot of the homework beforehand so that we could just discuss it. The videos before the class, so we could discuss it during the class. And that was really helpful in terms of
do the pre-work.
Do the pre-work, especially when you're on a time crunch.
There's a one here from Judy. I'm a certified CHIP facilitator, but not yet started the first group. How do I connect with the local medical community? I've struggled to get attention, as you mentioned before, struggled to get the attention of these folks.
It is, what I would suggest? See if they will join. Like if you can do, have one person in each group, if they can have them join it first to see if they can see the differences. And once they see the differences, it's amazing. That's one of the things I would suggest. If you know of anybody, have them look at some of the CHIP videos, or some of, have them watch some of this where they've gotten folks the testimonials of folks who've gone through it. Right. And try and use that. I have a practice called Doc's Lifestyle Medicine. Doc's is Derek Olson, who's my partner, and Kim Scheuer. And what we would do is movies with docs, or we would do, and so we would bring the healthy foods and watch Forks Over Knives, or watch, What the Health, or The Game Changers. And we would bring that. And that's how we got one of the people from the county to be interested in CHIP, because they came to one of those. So if you start doing those for the physicians, maybe a movie with CHIP, and bring the food, show the movie, show how it makes a difference, that might help.
Well, our local CHIP guru is a lady named Kathy Randall. And Kathy, the short answer to this question for me is persistence. Similar to what you did. You have to at sometimes become, and I'm not saying that Kathy was ever a thorn in my side, because she wasn't. She actually would come, but this took like 2 years. She would come to visit me on and off for about 2 years. And one thing that she always did was she always brought food. She always brought good food. Absolutely. So I would taste the food. And after a while, I was like, okay, I have to learn about this CHIP program. So persistence and sharing food with people to actually help them to understand that you can eat healthy food. You can eat things that you never ate before that's more delicious than the standard American foods that you've eaten for years.
I saw that Gina S. asked if there was a food plan that I follow and recommends for myself and my patients. So again, it's whole food, plant-based. I start with my patients, I do the Daily Dozen app on their phone with Dr. Michael Greger, which it's a quick app that they can use. I also introduced them to the PCRM's Jumpstart program. And again, there's so many other, like Rochester Lifestyle Medicine Institute has a Jumpstart. CHIP has a great program. I mean, even in the beginning of CHIP, it's great. But for my patients who, if I can find a CHIP program for them, or if I'm doing a CHIP program, that's what I want. If not, if they're just starting on their own, the Daily Dozen app with Dr. Greger on your phone, easy. You just check off, I've had the fruit this time, I've had berries this time, I've had some grains. And it's so much food, you probably won't want much more.
Exactly. Well, you mentioned Rochester Lifestyle Medicine Institute, so we'll have to give a shout out to Ted Barnett.
Yay, Ted Barnett.
And I'm sure that you've seen his little movie that he put together, Feetben? Yeah. And for the people that are on the line, if you haven't, I'll have to put the link in there because it is so funny and so it's funny and serious at the same time. So we'll have to put the chip in there and let them see that. But Judy asks, so bring food to my next physical when she visits her doctor?
Absolutely.
Right, exactly. Bring them food.
Absolutely.
Yes.
I mean, so many physicians have not a clue.
Exactly.
It's and I can't say anything bad about them because I didn't have a clue. Right. So I was there. So they need education. So many I've had physicians say they need more protein. You get plenty of protein on a whole food plant-based diet. You get more than you need. So if it's a physician who says my patients are athletes, they need more protein, I tell them to go watch the Game Changers. If anybody hasn't watched the Game Changers, watch that movie.
Absolutely. Right.
So, and then the physicians, I have one cardiologist where I used to work who said, I know it should be plant-based, but my patients won't do it. I won't do it. So bring them some healthy food that tastes delicious and get them to start doing that.
Yeah, that's the key. So Denise is asking, do you work, collaborate, or refer your patients to registered dietitians?
That's a good question. In Aspen, there was one fantastic registered dietitian who was plant-based, and I trusted her knowledge. Right. There are a lot of registered dietitians who are taught, just like physicians are, incorrect information because there's so much money supporting the dietitian association or the physicians associations. You'd go to conferences and they'd serve pizza and soda. That's not healthy. And so you have to find a registered dietitian that you trust. And there are plenty out there who have studied this, and there are more and more out there who are moving this way, and that will support what you're trying to tell your patients, because confusion is really hard for patients.
Right, exactly. Yeah, and there is a website for plant-based doctors that people can go on to find someone in their area. But I agree with you. There's one or two dietitians that work for my old health system that when I was working at Lee that are plant-based. But it's unfortunate that a lot of healthcare providers in general, not just dietitians, are still talking about, well, a calorie is a calorie and just cut down on your calories. I mean, that's nonsense. So the CHIP program is really designed to help people understand the science of lifestyle medicine and nutrition. I think that's the reason that it works.
There's one other question I thought was really good.
Yeah, please.
How do you handle your Milky Way urges now? I have a sweet tooth. And that's a great one. That's a great question. So first of all, I try not to get extra added sugars in my food because I am a sugaraholic. So if I try not to. So I'll do watermelon. I'll do fruits as a substitution for sweet tooth. You can use dates, but you don't want to do too much because that's very concentrated. And it depends on if you're trying to lose weight or not. Yeah. But I find that because I've cut out so much sugar, I don't crave as much sweets. However, if somebody gives me, a very sweet thing, that will trigger me back. And so I'll just have to cut it out again because I'm an addict on that. But I'd say go to the fruits, and whole fruits. You do not want fruit juices. You want a whole fruit And that works really well for me. I don't know, Dr. Sell, if you have any other suggestion on that one.
You know what I made last week was so-called chocolate pudding with avocado.
Oh my gosh, so good.
Oh, it was so good.
Gosh.
Now, obviously that's higher in fat and calories and such, but it was really amazing. So if you have a little bit of it, and I gave it to my daughter and my mom and didn't tell them what it was, and they didn't know the difference. Yeah. So, you can definitely satisfy that sweet tooth. Yeah. Yes, nice exactly.
Cream. Has anybody, if you don't know what nice cream is, it's take some older bananas that are about to go bad, just chop them up, put them in the freezer, and then just pull them out and put them in your in a Cuisinart or in your Vitamix. Mm-hmm. You can add if you want a date. You can add if you want some anything you want, like a fruits or something like that. But if you have it just plain, just the bananas. Yeah. And just stick it in. It is so delicious. Oh, other one, I forgot, frozen grapes. That's my go-to now too. So if I have a Milky Way, craving, I have a whole bunch of grapes in the freezer and I go pop a frozen grape in my mouth. It is amazingly good. Amazingly.
That's a great idea. Yeah, because so often if you buy a lot of fruit, it starts to go bad and you end up throwing it out, unless you put it in your blender. So that's a great idea. I like
Jennifer,
that.
You got it. You're right on top of it.
Okay, so what action item would you leave the attendees with so that they can start to do something additional today or tomorrow?
I would add a piece of fruit or a veggie every day, or like add a salad before you have your dinner. You want to eat that first. You want to crowd out the bad. So if it's just one thing, and then have fun, go out and run around and play, have some fun, but it's adding the good stuff to crowd out the bad stuff. And check out Chip. It's amazing.
There was a research article that I read not too long ago that showed that people that would eat a piece of fruit before a meal ate 300 calories less in the meal.
Right.
So yeah, you're exactly right. I mean, eating something that's healthy, that's high in fiber, that's high in nutrition and low in calories is a really great way to start your meal instead of starting it with a loaf of bread and olive oil.
Absolutely. Absolutely.
So, yes,
and drink a glass of cold water before you eat.
Right. Right.
Have a glass. Stop, because I'm a compulsive eater. Mm-hmm. So if I just stop and start and have some water before I even eat, that helps me to slow down. Another really quick one is if you're using a fork, put it down between bites.
Exactly, right.
And then pick it up again.
Well, for people, if you've ever been to a blue zone, so I was in Sicily a few times in Italy, and it really is amazing how they enjoy food slowly, not eating like maniacs like we do here, where you just gobble down your food and you get up and you run away from the table. So really, to your point, eating slowly, putting your fork down, enjoying the experience of actually eating, because it should be an enjoyable experience. Doing all those simple things can really make such a big difference.
Lisa had a question about substitutes for potato chips. And Lisa, I want to tell you a story. I was at an airport after I started doing this. And I was just pigging out from a bag, which I shouldn't be doing. I shouldn't be doing this. A woman across from me was doing the same thing from a bag. And she was big and I wasn't. And all of a sudden I realized the difference between her and me, because she was what I used to be, is her bag was chips. Mine was a thing of salad, one of those pre-made salads. So we're eating the same way, doing the same thing, yet I had 40 calories of healthy food and she had 400 calories of unhealthy food.
Right. Exactly.
So as a substitute for potato chips, grab a bag of salad and start eating it. Or have cut carrots or cut peppers, in your fridge and just grab that instead. So it has a little bit of crunch, and just gives you that mouthfeel. So
have you ever tried cutting up a sweet potato? Not cooking it, but cutting it up?
No.
So take the skin off, cut it up into chunks, put it in the refrigerator for a little while. It is, to me, it's even better than eating carrots.
Interesting.
It's got the crunch to it. It's obviously really healthy.
Yep.
It's one of the biggest. The sweet potatoes is one of the biggest foods that one of the blue zones. I forget exactly which one that they eat a lot of.
Okinawa.
So
purple sweet potato.
yeah, probably so. Yeah. So, just having those little tips and tricks really makes a big difference. So,
yeah.
Kim, I want to thank you so much for being on the show.
Thank you.
This has been really tremendously educational. Thank you for being such a great role model for healthy living and for doing all that you do for the CHIP program. It was
Ditto
great to
for
see
you.
you.
Thank you so much. You guys take care and have a great one.
Well, thanks everybody.